African American communities have been hit particularly hard by Covid-19, but how much of this excess mortality can be explained by persistent poverty? Graziella Bertocchi of the University of Modena and the EIEF has been using data from Chicago to find out. Hello Graziella, welcome.
Hello Tim.
Now, the fact that people of colour are disproportionately affected by Covid-19 has been well reported, hasn't it, in the last few months. How big statistically is the difference?
Yes, what you said is true. There has been a lot of attention about this disproportion, which has been spotted in the US, but also in the UK. My research is focused on the US, so I will speak mostly about the situation in the US. What happened and what raised our attention, mine and the attention of my co-author Arcangelo De Mico from Queen's University Belfast, were initial attempts to assess this disproportion. So the media and public authority in the US early on, as early as the beginning of April, tried to quantify the bias and indicated there were different estimates that African Americans in the US were dying from COVID at a rate 2 to 3 times higher than their population share, which means that the difference was 200 to 300% than the rest of the population. So this was a big difference. These figures were based on data that didn't say very much. It is now well known, even today, that the data collection in the US has not been satisfactory. At some point, we find some excellent source of data for Cook County, the county that includes the city of Chicago, that provided information at the individual level. So we had information about each individual that had died. It was only about death, not cases, but we had information about each individual that died from COVID, with information about race, which was crucial for this investigation, but also other sort of information which turned out to be very useful. When we did the computation, it was mid-June, and on the basis of Cook County, it was true, African Americans were overrepresented. 35% of the deaths from COVID were represented by African American in Cook against a population share which was smaller, 27%. So there was overrepresentation, but the overrepresentation was smaller. The rate was 1.3 times higher if compared to the rest of the population, which means 30% more, not 200 or 300% more. So there was a difference. The difference was not so big. So this was initially a puzzle, but soon we realized that the early data, remember, beginning of April, were referring to the beginning of April. When we redid the calculation for Cook County alone at the beginning of April, we found a similar picture. So again, African Americans were more than twice more represented among COVID deaths than in the population. So what was going on? There was a trend, which actually the media has largely overlooked, that was basically capturing the following. African Americans were overrepresented, this is a fact, but they were also getting sick and dying eventually from COVID earlier than the rest of the population. As a consequence, for them, the epidemic started, peaked, and also subsided earlier than for other races. So what we captured in June for Cook was basically the ending phase of the epidemic. It was not a more favorable situation. It was just the end of the overrepresentation.
Now, when we're looking at the causes for this differential, there are many explanations around as well. Which ones should we be taking seriously and investigating?
Well, there is certainly something having to do with pre-existing health conditions, which doesn't say very much because pre-existing health condition could be biological and genetical, but it could be themselves linked to socioeconomic factors. Still, even within the medical literature, the emerging consensus is that the race differential in the representation of death, of COVID death, is also associated directly with socioeconomic correlates. Indeed, I will talk about our data more in a minute, but this is what we find. We do find in our data for Cook that some diseases, in particular hypertension, for example, do increase the death risk for blacks in Cook, but they cannot explain the full extent of the differential. So this is why we dig deeper into alternative explanation having to do with a variety of socioeconomic factors.
And the Cook County data is ideal for this, as you say, because a lot of the other data seems to be aggregated.
Right. These are individual level data. So for each individual that died from COVID in Cook, we have information about race, but also age, gender, and all the comorbidities. Not only that, but a crucial piece of information that we do exploit in our paper is the information about the residents. We have the geographical coordinates of the dead, and we can use that. As this is a unique source of information, certainly for the US, but even for other countries. This is very detailed. In addition, it is partial in the sense that it is only one county, but it is a big county. There are 5 million people living in Cook. It's the most populous county in Illinois and the second most populous in the US. And in terms of COVID death, it was third after 2 of the counties of New York.
Now, as you say, it meant you could exploit some geographical data as well. The title of your paper is Race and Redlining. We should explain what redlining means in this context.
Yes, redlining historically refers to a practice that was introduced in the 1930s after the Great Depression to classify neighborhoods on the basis of their credit risk. The purpose was a good purpose. It was part of the New Deal. The attempt was to revive the residential market and the credit market by assessing the risk associated with credit. There was a corporation, a government agency, the Homeowner Loan Corporation, the HOLC, that was created just to produce this ranking. In practice, what happened in the American cities, over 200 American cities where the ranking was produced, the worst rank, the red line one, being red was the worst possible ranking, were occupied de facto by African Americans. So these people living there were de facto, this was the purpose, prevented from having from credit, from investing into the housing, and this over time there is a big literature, favor the development of segregated neighborhoods, unemployment, low housing quality, unhealthy living condition. Cook was red line, so it was examined by the HOLC. So we have for HOLC we have this information, and we can combine the information about the areas of the city with the information about the COVID death of the city, because as I mentioned, we have information of the residents, we have the geographical coordinates of the home address of all the deceased. So we can cross the data and obtain a map at a very fine kind of boundary, the census block group, which is a very small geographical entity, and each death is mapped into a specific block group and the corresponding ranking.
So what happens when you use this historical deprivation as a way to explain excess mortality?
There is an important point to be made. We have the information about COVID deaths, but about all deaths. These are the information collected, in the case of Cook, by the medical examiner. And it is crucial to look at all deaths because with our empirical approach, an event study approach, we will look at the situation by HOLC area, depending on whether a neighborhood was red line rather than green line or whatever. And we look at the before and after period with respect to the beginning of the epidemic. So we look at overall death rate, and the purpose is to capture the reaction to the COVID shock after the COVID shock manifests itself. So we are looking at the treated blocks, the ones that were in a worse position in terms of redlining, and we try to assess if they deviate more in terms of mortality compared to the untreated one, the ones that received a better ranking. And we find that this is the case. If we look before COVID, we start from January 1st. We do a lot of further checks and exercises, but the main result can be stated by looking at the period from January 1st until mid-June of 2020. From January 1st until the outbreak of the epidemic, which starts in Cook in mid-March, the first death is in mid-March, there is a difference in mortality. Blacks used to be dying more than whites, but this was not differentiated across neighborhoods with a different ranking. Once we look at how mortality behaves after COVID, we see a big increase in mortality for all races, but the increase for blacks is much larger than for other races. It goes up by 60%. And this happens only in the treated block groups, which are those that were badly ranked since the 1930s. So this is the main result. The reaction to COVID is worse in terms of death, and in particular about death by blacks in those neighborhoods that had this history of redlining.
So we can say from this approach that you've taken that the historical deprivation that was experienced by the African American community in this area is causal in the excess deaths from COVID-19.
Yes, this is not just a descriptive analysis. In our paper, and there is also the descriptive analysis, and there are interesting things. But let me focus on the answer to your question. The event study approach that serves for the purpose that I just explained to derive this result is producing a causal result. As I said, we compare the pre-shock period with the post-shock. The shock is COVID, and we can compare how the neighborhoods in the county and in the city of Chicago behave before and after. So in the econometric jargon, this amounts to a test of the parallel trend assumption, which is crucial. There are other reasons to believe that our result can be taken as causal. For example, given the fine structure of the data set at the block group level, as I mentioned, we can also control in our regression analysis for block group fixed effect, which means that we can filter out the effect of anything that is invariant during this period from January through June. More, there is also potentially, when you do this sort of analysis, an issue with sample selection, but it is ruled out once we look, as I said, at all the death. We look at all the parts of the county, all the groups, the blocks in the county, because there are also groups where there were zero COVID deaths. So there is no, again, in jargon, selection in this part. So this is another reassuring feature of the analysis. And lastly, and interestingly, we also perform so-called falsification tests. For example, we redo the same analysis exactly for the past 3 years before 2020. We check what happened in the middle of March in the past 3 years. It could have been the flu that produced the result that I have explained. But we find no jump in mortality for blacks or any other race, for no kind of neighborhoods in the previous 3 years before COVID. We also look further back in 1918 when the Spanish flu hit Chicago and the county. And again, we didn't see a surge of mortality related to the flu in the treated, badly ranked neighborhoods. And this is crucial because 1918, of course, was before the redlining, before the 1930s that created this distinction.
Graziella, these policies that led to these pockets of social deprivation in Chicago, they happened almost 100 years ago. Their impact is well known. Isn't the fact that now it is still causing excess deaths from COVID-19 an extraordinary failure of policy?
Yes and no. You are right. There has been an effect of this policy were found by us, but also by others in many realms, medical realms, also for other counties and other areas, other cities of the U.S. So there is certainly a result, but first of all, we should say that we don't see the counterfactual. We don't know without the policy that you alluded to what would have happened without them. It could have been worse without social policy in general. In fact, there is an interesting paper, companion to ours, doesn't look at COVID, was written before by Aronson and co-authors from the Chicago Fed. They look at the effect of redlining on racial segregation and house values. And they found that the effect stays from the 1930s until the 1980s, but then starts to wane. So this could be because of the policies. The policies were essentially, starting around 1968, there were two sets of policies. The first act was the Fair Housing Act in 1968, and it was part of a package that was introduced to expand access to credit to low-income households, so precisely in order to reverse the effect of the redlining. Some effect has been detected by those that look at these outcomes. Another set of policy were precisely targeted to racial segregation. And of course, there is research that has demonstrated that, for example, desegregation in schools had beneficial effects. But perhaps I should cite a quote that you all have heard about. There was a little girl in California who was bused to school every day. And that little girl is Kamala Harris. And that happened to her in 1969. So if she's now a candidate for the vice presidency, perhaps we can still give credit to the policies that were introduced, even if the job is not completed, that's for sure.
Graziella, thank you. That's very interesting, both as an insight into what's happening at the moment and also the long-run effects of policy. Thank you very much.
Thank you, Tim. It was a pleasure.
The paper is called COVID-19, Race and Redlining, and the authors are Graziella Bertocchi and Arcangelo Di Mico. You'll find it in COVID Economics 38. Now, the same authors have written an introduction to the topic as a VoxEU column, and that's called Race and the COVID-19 Pandemic. Keep in touch with the coverage of COVID-19 at VoxEU, and we'll see you soon.